Thank you. I titled mine The Men in Black Scrubs. I have no disclosures. So over the past 5 years I've been here, I'm sure some of you guys have seen these guys walking around with the black scrubs. This is them packing up my house for me. So you can make them do things or helping pull or put in chest tubes, right? And then often I think no one knows who they are, so they don't teach them or utilize them. And I want to advocate for them. So most of those guys are Green Berets or Special Forces, as they're called. And all this started back during World War II with the OSS, the Office of Strategic Studies, which was forebears to both the CIA and Green Berets. And this is Wild Bill Donovan, who has every possible medal you could have, and they put him in charge of this program, which led to these Jedburgh teams, which are these little three-man teams. They trained them. They were like one French guy, two Americans or a Canadian. They gave him a gun and a tiny little radio. They flew him over the top of France. They threw him out of a plane and they said, find the French resistance and blow things up. And that's what they did. Lots of stories. And then when they got captured, they got executed because they were considered spies. And they would meet up with these French resistance, blow up bridges, harass the Nazis, raid things, and just generally cause havoc in preparation for the invasion. After World War II, there's a big discussion what to do with all of these different forces. So there was a big split, and that's what became the Central Intelligence Agency, which was the strategic portion of that. And then Special Forces became the military portion of that. And my SF guys over here are nodding their heads as they see how I breeze over a big part of it. But it was a big, nice, big split. And then this led to what is like now the modern Special Forces, which are the guys who come here. They first arrived in Vietnam in the late 50s. The most decorated soldiers and units in Vietnam were all Special Forces. Most of them from 5th Group, the superior group. It's true, he knows. Over 17 medals of honor, multiple distinguished service crosses, hundreds of silver stars, and thousands of bronze stars. The biggest step in Special Forces that every Green Beret when they graduate knows is in 1961, JFK came and met this fella and said, you guys can wear a Green Beret because Big Army has lots of rules. It's the most bureaucratic thing that's ever existed. And the only way it would happen is if the president showed up and said, these guys can do this, and told him it's a symbol of excellence, a badge of courage, a mark of distinction, the fight for freedom. Nice lull where nothing happened, and then 9/11 happened. After 9/11, the first soldiers, the first people in Afghanistan were Green Berets from 5th Group. There's some nice movies on it, but they were flown in, dropped off by helicopter, got on these horses, little 12-man teams that I'll tell you all about, and then found this guy, Karzai, who later became the president for a good decade in Afghanistan, and helped a bunch of guys on horses take out the Taliban who were driving around tanks. And all this was done in days. The war afterwards obviously went for a couple decades, as we're all aware, but the initial invasion and destruction of like Taliban as a state and as a country was done within weeks by a bunch of guys on horses. So I include some nice pictures of me. I first went in 2004. It's my grandmother. I look pretty much the same. And the best part is as these pictures go, you'll see that cameras get better, which was a nice thing. Here's some nice little kids from Afghanistan and Kabul. I don't really have much to say about them, but the only thing they want in this world is Pepsis and pens. And I don't know why. I went again in 2006. I had a nice year-long break into a different part. You can see how beautiful Afghanistan is. 14,000 footers on the east side, beautiful trees, tons of rapids. And then this is not me, as a friend of mine, but you could see the cameras continue to get better. And then again in 2009, because I couldn't stay out of there. And at this point, I was in Special Forces before I was an infantryman, and beard looks the same. a little more gray, sadly. And then here in this part of that country, a lot more snow and a lot more use of helicopters. Special Forces went into Iraq, obviously, in 2003. The big mission during that was Fifth Group again. I can't advocate for them enough. And they spent most of their time in the western part of the country looking for those weapons of mass destruction. So mounted in trucks, dropped off in airplanes, and then drove around looking for scuds and any chemical or nuclear weapons. Special Forces and some of the other special operations include SEALs, who also rotate here, spent a good portion doing raids, as you can see in this picture, with dogs, which is relevant to the medics training here, all over Iraq. This is the first time I ever taught medicine, though I knew nothing, and taught some Iraqis how to use a tourniquet, which at that time, we just took a piece of cloth. I don't know if you can see it on the screen. That little piece of orange right there is like the cap off of a gallon of milk. And that's what we use in a stick. And then we teach them to twist that around their buddy's arm and use that piece of plastic to hold the stick. And you think the tourniquets we use only cause venous occlusion. I'm sure none of these ever stopped blood, but a good part of combat medicine is convincing the guys you work with that they're invincible. And part of that is telling them you can fix them. This time in Iraq was a lot of raids. One of these guys is me. Oh, I'm right in the center. With a terrible mustache. Afghanistan's all about beards. Iraq and the Kurdish soldiers all have mustaches. So I had a horrendous mustache. I went back a second time to Iraq because I didn't have enough fun. And this time as an advisor in between the wars. And everyone who goes to Iraq at some point gets a picture under these swords in Baghdad, if they can. And a lot of our time there was spent as an advisor to these fellows over here, which is the Iraqi Special Forces or Special Operations Forces, convincing them to how to fight. Not really part of the talk, but always fun to think about it. So in Iraq, there's a massive amount of corruption, which is hard to explain how much, but within what's supposed to be the best unit in all of Iraq, the Iraqi Special Operations guys, they take their money and they build water fountains with it, like not to drink from, but like pretty water fountains that spray water in the air. And then they charge their soldiers money to go places, and then they use that money to fix their equipment. Like, it makes no sense, and it just continues that way. So currently there's Special Forces soldiers all over the world. Usually at any time, there's at least one SF team in about 80 countries. Anywhere from Colombia doing counter narcotics, Albania doing counter human trafficking. Right now there's teams all over Europe training Ukrainians outside of Ukraine on how to fight, including friends of mine. In Africa doing counterterrorism, and then in East Asia doing counter China and helping those teams or those countries get comfortable. And a lot of these teams in SF are there just, it's all about building relationships. The king of Jordan came to America and trained in special forces. The current prime minister of Israel. Man. Does she want me to start over? Share screen. And then in East Asia, but a lot of this is about building those relationships. The prime minister of Israel, Benjamin Netanyahu, is trained extensively with these teams. And all of these relationships pay later when these areas of the world go into conflict. And just to point out how small the world is, this picture here is a guy from my team training in Poland. That guy right there actually came here as part of one of the medics in the Black Scrubs here and trained with us here in West Virginia. It's an extremely small world. And then here in Slovakia, doing the same thing, teaching. And then this is the president of Paraguay with a team I led, that we took his guys out to the range and shot, and here he is hanging with us. So there's definitely a lot of influence these guys have. Special forces, these guys who come through here are in the middle of their training, but their core mission is unconventional warfare, guerrilla warfare. So the first guys into Afghanistan, the teams running around Ukraine and doing those sorts of things, subversion, sabotage, like the Jedburgh teams did. And then, of course, a lot of other things get thrown onto them, including hostage rescue and raids. Foreign internal defense is a nice way to say that we go to peaceful countries and we hang out with their military and shoot guns, and then build relationships, special reconnaissance, and then counterterrorism often comes out of special forces too. These teams that come through here, or the guys who come here, are on their way to a special forces team. These teams are small. They're only 12 guys, and they range from the detachment commander, like Ben. Raise your hand, Ben. He gets an assistant who's a warrant officer. You have a team sergeant, which is what I did for a while, an intel sergeant, and then 2 weapons guys who are probably the best guys on the team. They do all the fun things like shoot sniper rifles and tell everyone else how to do their job. You have 2 guys who specialize in radios and computers. 2 guys, they're called engineers, but really what they do is build bombs and teach everyone else how to build bombs to blow up bridges or doors. And then no one will ever admit it on a team, but probably the 2 most important ones are the 2 medical sergeants. And these are the guys that you're seeing come through here. I think it's worth mentioning a lot of these teams come from the National Guard still. And one of the first Green Berets to die in Afghanistan was a junior medic on a team out of 19th Group. And that guy's civilian job was ED attending. So they're definitely connected to us. These guys who come through here are in the middle of about 3 years of training. They start with basic, they go through selection, a qualification course. A lot of them learn how to do free fall. And then if they're lucky, some of them will get to go to specialty schools later, and to include combat diver, mountaineering, sniper, learn how to be a jump master, the guy who tells people how to jump out of planes. Their training starts in basic training in the Army, which is 10 weeks of being bald, wearing the ugliest glasses possible. They're often called birth control glasses, figure out why. And then another 12 weeks of infantry training, which is, honestly, they make it sound like it's advanced, but it's really, you're still wearing the same glasses and someone's still yelling at you. I'm in this picture somewhere. This is back when the camera wasn't as good. I think my mom took it. After these guys finish training, a lot of them will go and do stuff in the Army, but a good portion of them, especially now, go straight to selection. Selection's a 3-week course where they try to identify people who will succeed. Not always the best, but it works. And they do 3 weeks of fun things like run and carry heavy things. They like to mess with you. You take a lot of psych tests to see if you're crazy, which is kind of funny. And then, I don't know, do you remember your psych test, Ben? I remember you had to tell whether, for mine, it was like, would you rather be a bee or a flower? I don't know the answer. I chose bee. And it's like 300 questions of that. And I don't know, I passed, and Ben passed. So during that first week, their goal is always to find people who will quit and then get rid of them. So during that first week, they'll say, start running that way. We'll tell you when to stop. And then you just start running. And then all of a sudden they say, stop. They don't tell you how long, no watches. And then no feedback, which I know we all crave feedback. We pretend we hate it, but we all want it. Imagine if no one told you feedback, never told you, are you doing well? Are you going to do this for 3 weeks? And we already know we're going to cut you. Like, it just keeps going. The second week is land navigation. They teach you everything you need to know, and then they make you carry this giant pack, and they give you a little compass and a flashlight you're not allowed to use. And they tell you to walk for the next 12 hours and find some creepy guy in a tent. And then he'll tell you where to go next. And it just goes and goes and goes. And it's just you all by yourself with your thoughts, and you're not allowed to use the road. And then it ends with the worst part, which is a week of team events. And it's just like a horror show of like great ideas. Brian, did you guys do the 3-wheel Jeep? It's my favorite. So they give you a Jeep. There's 12 of you. You're still carrying that pack. You never get to set that thing down. And they give you an old like World War II Jeep with 3 tires and 1 tire missing and some metal bars. And they're like, we want you to move this Jeep like 6 miles over there. And that's all the guidance you're given. And then you just push it. And if you hate everyone around you, it becomes a real miserable experience because all it does is fall over. And your goal, and I'm sure this was your moment to shine, Brian, is to be the smallest guy on the team because that's the guy steering. Everyone else can push. Like you don't want the heavy guy there. And then you get to do other fun things like here, carry this thing around, or here's a telephone pole that needs moved. It's a lot of just moving things and then someone watching you to see if you yell at each other. And if you're the guy who snaps and gets angry, you disappear. And then at any moment, there's a guy saying, hey, if you want to stop and come over here and eat lunch by this campfire, you can. So there's really no incentive to keep going. But, and then at the end, they line you all up and they call off a number and split you in half. And then you have this essential dread inside yourself wondering, am I in the half that's getting booted or am I in the half staying? And then you look at that guy who you thought was amazing, who probably turns out thought he was the flower and not the bee. And you're like, that guy's going to pass and he's in a different group, but turns out he's in your group. So the guys who pass then go to airborne school, which is 3 weeks of falling down. So that when you think of airborne school, you think of this part. This is like 30 minutes of 3 weeks. The rest of the time, they have you stand on a platform and jump and fall. And you just fall and fall and fall and try not to hit your head. And you learn all sorts of techniques to hit the ground and not hit your head. And it doesn't matter because the first time you do it, you land on your feet and then you land on your butt and then you hit your head. And it's kind of pointless. That guy's the jump master I'm talking about. He's going to tell him to jump. So they spend 3 weeks doing that. Then they get to move to Fort Bragg for the next 2 years of their life, which was Fort Liberty for 6 weeks. Now it's back to Fort Bragg. This is in North Carolina. North Carolina is beautiful. Everything around Fort Bragg is not. It's right in the middle of the state. So it's not near the mountains. It's not near the beach. And then Fayetteville, North Carolina is everything you hate about a town in one place. But they keep them so busy that no one notices how miserable they are. They get there and one of the first things they do is go spend the next 10 weeks in the woods, walking around doing ambushes on random cars while you're constantly being evaluated. And then at any point, if you're not performing, you disappear and then go do something else in the Army. After that ends, probably the best school they ever go to, which is SEER, Survival, Evasion, Resistance, and Escape. During Vietnam, I'm blanking on his name. Nick, what is it? Rowe. Nick Rowe. Nick Rowe was a Green Beret in Vietnam who got captured and spent 2 or 3 years as a POW. And after he got out, he realized, man, I wish I would have known more about how to get beaten. So he started a school called SEER, which now most pilots go to, and then all of like special operations. And it's 3 weeks, but the first 2 weeks is Boy Scout camp. I included a fire because that's a graded event. You get to build fires, you learn how to butcher a rabbit or a chicken, depending on which one you get. You learn how to break into cars and try to steal cars, but only works on 1970s Ford trucks, which is super common around the world anymore. And a bunch of just fun things. And then it all ends with someone capturing you, putting a bag over your head and beating you for a while. Which is also a ton of fun. But it's only 3 weeks. Then those guys finally start to learn something medical. So the Special Operations Combat Medic course is 36 weeks. And then they followed up the Special Forces medics with another 16 weeks of the medical sergeant course. During that first 36-week phase, I wouldn't say it's like med school, but it's that same level of intensity, except without any like outside time. So they're in classrooms or training all day, every day. And then if you fail, you just disappear and you go to the regular army and become a cook. So there's a significant amount of fear for these guys to continue. I'll be honest, I wasn't a medic, so some of this, if I'm wrong, feel free to correct me over there, fellas. But during this time, they now get an associate's degree. They do BLS. They all finish after 36 weeks as a paramedic. They do ACLS and ATLS and all those other 3-digit acronyms, and they just practice trauma over and over on simulated patients and cadavers, and they're constantly graded at every moment on everything they do, and it just keeps going. And then when they finish, they spend a month or so in a hospital, not ours, we're not one of them. And at an Indian reservation, a lot of them go to Flint, Michigan. And the focus of that hospital rotation is different than what they do here. And it's all about trauma and pre-hospital care. So they ride a lot in ambulances or in the helicopter and a lot of time in the ED. The ones who pass that and are going to do special forces end up going to this next course. That's another 16 weeks. So they start covering things outside of trauma. A special forces medic is expected to be an expert in like pre-hospital trauma care, but they're also expected to do weird things like help some Afghanis butcher a sheep, or help Iraqis take care of their cow, which has both happened in my experience, or help diagnose a little kid's eye infection so that their dad, who hates us, might actually like us. Because if you take care of someone's kid, their parents can't hate you. They learn how to pull teeth, which is a big problem everywhere we go, dental work. They learn how to do some like basic x-rays and take some images. Though when they do it with one that used for bombs instead of people. So all their patients glow. They also learn how to do some basic anesthesia and surgery. And these things are actually happening. What they use is a skill. I have a friend of mine who's in Syria who did bilateral above knee amputations. And you're like, we can do that. But they also did it. They did all the anesthesia, him and his buddy, by themselves with everything they had. So all their ketamine. And when they ran out of ketamine, some Versed. And then when they ran out of Versed, they gave him a whole bunch of Benadryl while they chopped his legs off. And the guy survived. And they did it in a tent in the middle of nowhere. So when these guys come through, the things you teach them, they're going to use. While they're here, they spend, at the end of the Special Forces Medic Sergeant course, which is the last phase of their medic training, they spend 1 month at a hospital site. And this is where we are. We're one of them. They've been coming here since 2016. Them coming here is the reason I came here. In the last decade or so, we've had 380 students. They do a 4-week rotation, and even though they all gravitate towards trauma and we all want to take them to the trauma, especially me, their purpose here is not that. They've already had that portion of their training. A lot of it is learning how to do basic blocks with anesthesia, learning how to take care of teeth on an actual patient. They spend a few days with down in Wardensville learning how to take care of large animals and do basic vet care. They go to Cheat Lake and learn how to take care of dogs, because that picture I showed earlier with the dog, the medic's expected to take care of them too. They spend some time in the neuro ICU and with wound care, obviously on trauma and derm, and in the thing that's probably most important for them and the thing they hate the most, urgent care. A good portion of their medical side of their career will be a guy like me asking what to do about this cut on my leg.